back to the first one. Okay, is this on? Mm-hmm. Okay. We're going to talk about emotional regulation strategies for these youth with complex needs. And that's just the outline. And I just thought I'd go over the quick definition of emotional deregulation. And the youth we talked about today kind of is the definition of that. Severe recurrent temper outbursts with verbal or physical outbursts that are out of proportion in intensity and duration, and they can last for a long time, and there's kind of a persistent irritability that's there most of the day. Usually this starts before they're 10, and this is a negative affect that's there and it persists. And you see this a lot with individuals who have interpersonal trauma and past traumatic stress. And this child we talked about today, with all these different placements, that certainly is traumatic and could play into what's gone on with her. And we don't know what happened in her first 2 years of life, and then being in foster care at such an early age and placement, that is certainly very traumatic. We know that trauma does affect the physiology of the body, and that there's a lot of stress response. It impacts the brains in ways that make it difficult to control emotions. We also know that the caregiver plays a critical role in being a positive change agent. The trauma sends an alarm throughout the body, tensing the muscles for action, and there's surges in the stress hormones and impacts the ability to cope with stress, to manage emotions, and controls the impulses. And this just doesn't happen and then stop. It's a prolonged response, and that's why it's so harmful, and it just keeps happening and happening to these children. And this impaired emotional regulation leads to dysfunctional coping mechanisms, being oppositional, aggressive like this youth, substance abuse later on. And it's harder for these individuals to access higher level of thinking during the stress and trauma. And it's harder for them to access language. And a lot of times we'll say to them, talk it out, but they can't talk it out. The early life adversity changes the threshold in the brain, in the limbic area. The undermodulated emotion, which is anxiety, is related to the heightened amygdala activation and the reduced prefrontal inhibitory activation. The researchers who did this research into this were DeVere and Ford, and they did neuroimaging, and it was their neuroimaging that explained the changes that occurred from the early life adversity. Overmodulated emotion, dissociation, emotional numbing is related to the extensive midline prefrontal inhibition of the limbic activity. And then the area that we're kind of talking about today that we saw with this child is what we call the default mode network. And this is the emotional dysregulation in the PTSD area, where you have the activation of the medial, temporal, and prefrontal cortexes in the limbic areas. Now, in our formal treatment, we do the trauma-focused CBT, the dialectic behavior therapy, EMDR, but today I'm really going to just focus on the mind-body integrated therapy. And these are the kind of things I think would actually help with this child today, because I think she would do much better with treatments that you don't have to talk. These are sensory-based therapies where they don't have to engage in talking. One of the kinds of treatments is breath work, and this is a conscious alteration of breathing, connecting with the inhale and the exhale. And actually research has shown that this causes increase in heart rate variability, it decreases blood pressure rates, you have decrease in respiratory rates, and actually can cause a reduction in anxiety and a decrease in depression and PTSD. And I found that really quite interesting. I was not aware of that. Mindfulness, and this is the moment-to-moment awareness in one's experience without judgment. I don't know if any of you have ever done the raisin experience, where you take a raisin and you think about what it looks like and what it smells like and what it tastes like. And if you do that, and it takes about 15 minutes to do it, it's really a neat experience. You should do it with a child. It really gets you into that moment-to-moment awareness. And this too develops affect regulation, cognitive flexibility, improves emotional awareness and tolerance and acceptance of distressful symptoms, and again, improves self-regulation. Guided imagery. This is use of relaxation and mental visualization, and this improves mood or well-being. It can help children interrupt intrusive or distressing thoughts, and it can teach them to gain control over their thoughts and feelings. Have them pretend that they're somewhere else, somewhere where they really enjoy, at a beach or at a forest, and can disrupt what's going on right then that they're so upset with. Expressive arts. I think we talked about this with this child. Music therapy, drama, painting, drawing. This can reduce the hyperarousal, facilitate expressions of emotion, improve self-awareness, and decrease hopelessness. Recently, I was involved with a group of high-functioning children with autism, or young adults with autism, where we were using drama to help them with their emotions. And it was really quite interesting to see how much they enjoyed it, and it really was quite therapeutic for them. But we weren't using it as a therapy, we were just using it as a fun activity, but it was very therapeutic. So we were talking a little bit about the rage cycle, and one of the things that I learned, and this was from an article by Miles that I referenced, so this isn't from me, this is from her. And the first thing we talked about was the rumbling stage. And she was talking about autistic kids, but I think we see it in all of our kids and we don't pay enough attention to it. And that is looking at what we talked about was, what kind of physical signs are we seeing? You know, are they grimacing? Are they clearing their throats? Are they tapping their feet? Are they tensing their muscles? Are they getting verbally challenging? And that's kind of the first sign that things are going on. And in this rumbling stage, the key thing is for the adult not to intervene and become part of the struggle. And most of the time, that's not what we do. We become part of the struggle. And so we have to try to learn not to do that. These are some of the things that you can do, and you've got to kind of learn which thing will work for which kid. Some will work for one, some will work for another. So what's antiseptic bouncing? That's sending them on an errand or asking them to go retrieve an object. So it's kind of, go do something, like bounce, go do something. The next thing can be proximity control. Just move next to a child. If you've ever seen a really good teacher and a child starting to get a little bit out of control, they just move right next to them and they'll calm down right away. The next is signal interference. Ahead of time, you might have kind of a secret signal with a child that when they start to show these rumbling signs, you give them this signal and the child will immediately go to their stress ball or something else that they can use to calm themselves down. Another one might be to immediately get them into something that's their safe routine. So you get them right back into their routine. It might be at school, and then say to them, as soon as this, you finish this task that's part of the routine, then we'll do something you really like. Or if you're out in the community, you might say, as soon as we're done with this errand, we'll go to this store that you really like, or something like that. Another thing might be just to start walking with a child, and you, the adult, keep your mouth shut and let the kid just talk or be quiet. Another thing might be to redirect them. If the child likes to draw, let them cartoon or do a drawing, and try to figure out what their problem is and to draw it out that way. And then the last one would be to have a home base, a place that is where they can go to escape the stress, a positive place, not a timeout. At a school, it might be a sensory room, or at home, there might be just a positive room that you have, but the key is not to make it a timeout room. So the key is you have to be really good at knowing those signs that the rumbling is starting. Once you get to the rage cycle, all is lost. There's not a lot you can do at that point except keep the child safe, and hopefully you don't have to do a restraint. Hopefully you don't have to do a restraint, because those can be very, not only dangerous to the child, to you, but are very, especially to a child who's been abused in some ways, are very, it's like an abuse all over again for them. And then there's a recovery phase. Some kids will say they don't remember what happened. Some will withdraw. Some will cry. The important thing is to help the youth get back into their routine with something that's really highly motivating that they can easily accomplish. The one thing not to do is to talk about what happened. You don't want to focus on the negative behavior that happened. The key principle from the behaviorist is the thing you pay the most attention to, you will get the most of. So if you pay the most attention to a negative behavior, you're going to get more negative behaviors. Wait to some other time when you can talk about a problem in a general way and work on problem solving, and do it in a more controlled setting, but not at that point. And so later you want to work with them on increased social understanding and problem solving. And there's all kinds of different problem solving techniques and things that you can work on with them. And then when you're out in the community and you need something in your pocket, there's a number of different coping skills. And again, this isn't from me. This was from this lady by the name of Marianne Riley. And I thought these were really cool. The one was hot chocolate breathing, and one was to have pictures of hot chocolate in your purse or whatever you have with you. And when a child starts getting upset, you take out the picture and you say, okay, cool down the hot chocolate. So, breathe, and then breathe in like you're smelling the hot chocolate. And what I thought was neat about it was to actually have the pictures, because that gives another modality for the child rather than to have them just think about it. And then the second one was take me there pictures. And again, that's what we talked about, the where you're
Imagery.
The imaging, yes, thank you. But this, you actually have some pictures, 3 or 4 pictures of places where the child likes to go. And so you take them out and you have them say, jump into the picture, and what do you see? What do you hear? What do you smell? What do you taste? What do you feel? And so again, you're helping distract them from what's going on, but you get them to a really pleasant place. And then the third is a type of a grounding kit. It's a sensory kit where you might have a picture of a dog, some Play-Doh, an essential oil, a hard candy, some earbuds for music for on your phone, so that you can tie into all the different sensory things to help calm them down. The next one is to draw, have a small half of a 3x5 card, and give them a pen and have them just draw their feelings on that as fast as they can. So again, trying to have them focus on that. And the last one might be just to have a bunch of Play-Doh and have them make some creations. So again, that would be something that you would have with you for an emergency when they're having a meltdown in the middle of Target someday. So these are just some ideas that might be helpful. And you would have to try different ones out with the child and see which ones work. There might be other ones that you all have some ideas about, but these were ones that I found, and I hope that they'll be helpful. Thank you.